Okay. Thanks very much. And good afternoon, and thank you for joining the Chamber today. I'll acknowledge first that we're meeting on the unceded territory of the Nanaimo First Nations, and we pay respect to them for allowing us to live, work, and play here. Hayichka. We're presenting this panel today in recognition of Canadian Mental Health Association's Mental Health Week, May 3rd to 9th. This was the closest date that we could get ourselves together in one spot to do this. The fact that tensions are running high is pretty obvious just by looking around ourselves, whether it's pressure in our workplaces, lowered tolerances among family members, a testiness in public spaces, or so many other personal interactions. Today, we'll talk about the ongoing crises in our community, where we've seen a public display of mental health issues among our street population, in some cases contributing to the homeless situation we're confronting in every community in British Columbia. We'll also explore the bigger issues of mental health in the province and our government's increasing efforts to deal with challenges and the bigger issues related to substance use. Lots to unpack here, and we're very fortunate to have Dr. David Fairweather of Campbell and Fairweather Psychology Group. Also, Dr. Sandra Allison, Island Health's Medical Health Officer serving the Mid-Island, and Nanaimo MLA and the Minister for Mental Health and Addictions, Sheila Malcolmson. I'll ask the panelists to expand on this introduction now and talk about their hope for outcomes from our talk today. Let's start with Dr. Fairweather, who's sitting in for Dr. Leanne Campbell. Then we'll move to Dr. Allison, and finally, Minister Malcolmson. If you in the audience have questions, please put them in the chat box, and we'll try to answer them by the end of the session. Go ahead, Dr. Fairweather.
Well, good morning, good afternoon. My name's David Fairweather. I grew up in Ottawa, and I completed my schooling at the University of Ottawa. And just to say a little bit more about me, after 10 years in the federal correctional system in BC as an assessing and treating supervising psychologist, I worked full-time in private practice for the past 15 years in Nanaimo and now Victoria as well. And I split my time between assessment and therapy. As a therapist, I do a lot of work with clients with histories of trauma and PTSD and depression, and I work with military veterans, with serving military, with police, with first responders, as well as other clients from the island community. A good portion of my time I also spend doing assessments for injured workers, and increasingly over the past year I've noticed that COVID-19 related issues have really come to the forefront in terms of presenting problems of these clients who are leaving on medical leave due to workplace pressures. I'm also an emotionally focused therapist and trainer, so a big focus of how I work and what I do is to help couples who are struggling with relational distress and seeking to get back to more connected places together. And I also train clinicians across Canada and internationally on this approach to couple and individual therapy. And I'm really happy to be here today to participate in this important discussion around mental health and the concerns and challenges we're all facing. And really excited to hear what others have to say and to just share together on this important topic. Thank you.
Thanks very much, Doctor. And Dr. Allison, do you want to expand on the introduction? Thank you.
Thank you so much for welcoming me. And Dr. Fairweather, thank you. That is a really important sharing about the community's stresses. As a public health physician and a specialist in public health medicine and a family physician in Nanaimo, I'm new to Nanaimo. I'm the medical health officer. My predecessor was Dr. Paul Hasselbach, and I'm very proud to take over his role in really trying to investigate and understand the health of the population in the Central Island. So Greater Nanaimo is one of my areas. And also as a family physician, seeing the stresses that we see in our individual patients in the clinic. I echo what you say, the stresses have really accelerated and been exacerbated by the situation we've been in over the last 15 months. As a public health physician, I'm responsible for the response to the coronavirus in the Central Island. specifically the response to coronavirus cases in our schools. I'm also the medical health officer that is collaborating with the primary care emergency operations team to strengthen our approach to primary care in our communities from a public health aspect. And then lastly, one of the other roles that I have is regarding our response to the toxic drug crisis and the fatalities we're experiencing. And we've seen an acceleration and an increase in those fatalities over the last several months. And I'm very happy to be participating in this conversation, because I believe that we do need to change conversations in our communities and become more accepting of what stresses in our lives do to our physical and our mental health. And it's through conversations like this with experts that we have around us that we can start to explore these situations and normalize this in our community. At least 1 in 2 people will experience mental health issues across the lifespan, and everybody's touched by it by their family members. So I'm really happy that we're taking some space to talk about mental health and mental wellness during this time. A week in a month is never enough to acknowledge this in our lives. It should be a regular opportunity to reflect on mental wellness in our community. So thank you. I look forward to the comments from others.
Fantastic. Minister Malcolmson, go ahead.
Thank you, Kim. I'm so honored to be here, and I want to recognize that I'm here on Nanaimo territory. The lessons that I've learned over the many, since 2002, I've been elected to 4 different levels of government, and throughout it, the teachings of Nanaimo First Nations leadership have been vital, and particularly the work that they've done internally, and I think are starting to fan out to the rest of us on community of care, on how to attend to trauma as the root of work when contending with mental illness and addictions crisis that we've been facing. That always grounds me in the work. So I'm grateful for their partnership and leadership, and very glad to be here with Dr. Fairweather and Dr. Allison. And I have had a couple of conversations. I learned a lot from Dr. Allison's predecessor, Dr. Paul Hasselbach. And I'm just really commend the Chamber for bringing this panel together to be able to lift the lid on some of the really tough problems that people are contending with, to normalize conversation, and particularly for it to be the Chamber is great. We are really lucky in Nanaimo to have a Chamber that invests deeply in the social infrastructure of our community. The definition or the interpretation that the Chamber has about its involvement in community activities and community problems is particularly generous in our city, and we're grateful. I'm grateful for that, and we need it. The really number one wicked problem, especially once I moved to the provincial level of government in 2019, early 2019, where the services that we are responsible for provincially are the ones that, number one, hit people most where they live. It's about the school system. It's about wait times in the emergency room, and it is about untreated mental health and addictions and homelessness. I'm extremely proud to be part of a government that is trying to make up for a decade and a half of underinvestment in these areas. But we are humbled every day by the enormity of work at hand. It's not just a question of throwing money at the problem. And COVID has made everything worse. Increased drug toxicity, increased number of people using drugs alone and therefore dying alone. Despite the progress made in 2019 of the measures that the province had brought in to combat overdose crisis, that all that progress was lost, that the death toll having dropped, that it has spiked worse than it's ever been during this year, is something that we see in our community, we feel in our community. And the increased rates of homelessness, the increased pressure on people, more people coming forward and presenting with anxiety and mental health challenges, this is a humbling amount of work that's ahead of us. And I know we're going to talk in more detail about this, but the pieces of work that the Premier's asked me to do as Minister of Mental Health and Addictions just dovetail so well with what I've learned serving the community already. When occupational pain is untreated and turns into an addiction problem, when we don't have the kind of supports in place that allow people to succeed in housing once they've retained it, the spillover that goes into the streets and social disorder that business and many community members have unfairly had to contend with. It's no life to live that life, let alone the terrible disruption that we felt in our community. These are all problems that we are, as a government, working hard to overcome, but we're not going to nail it without partnership. And it's conversations like this that help. So thankful to the Chamber for hosting the platform and look forward to more conversation.
Thanks so much, Minister. And thank you for the kind words about the Chamber. You know, people come to us and ask us, what does the business community think of this? And what does the business community think of that? And I have to remind them that our business community in Nanaimo is 92% micro and small businesses. These are locally owned and operated businesses in all sectors. So it's our neighbors, it's our family members. These are the folks who own and run these businesses. And when we speak to the businesses, I really feel that we're getting a very great representation of community community responses, community input, community feedback in general. And as you're speaking, you know, it strikes me that these are challenging and difficult conversations to have, but absolutely vital and essential to community health and to our success as a community. So I just wanted to make that comment on what you had to say there, Minister. Dr. Fairweather, you're providing therapy and care to patients and clients face-to-face on a daily basis. Since the pandemic started 15 months ago, what changes have you noted from your patients? Is contact with them up? Are new patient inquiries increasing? And what are the most common effects and the greatest needs that you've seen?
Well, in reading that question, I've been reflecting over the past couple of days, and I look back to the early COVID days, 13, 14 months ago. In terms of my clients, the reactions were all over the map, really. There was, of course, a lot of anxiety and worry. At the start, though, I was surprised to hear some people at least trying to embrace the forced opportunity, to at least some people trying to embrace the forced opportunity to live a simpler, narrower life for a while. I remember people sort of speaking of a forced reset that might bring the family closer, more quality time with kids. I remember a guy saying in mid-March last year, well, I can roll with this for a while. How long could this last anyway? I can put up with this for a few months until the summer if I have to. Like, that was the sort of not uncommon back then. 14 months into the pandemic, as we all know, so much has happened. I've certainly noticed the demand. Our clinic, the demand for mental health services has been substantially up over the last year. Of course, the introduction of vaccines are bringing some hope, and other developments are bringing some hope, but a return to normalcy can't come soon enough for so many, for all of us. So this week, I jotted down some things that clients have told me this week about their own current experience of the pandemic. And I thought it would be helpful to share some of those. One military veteran with PTSD told me, I feel in a box. I feel cut off from everything. I can't do my hobbies. I can't get out of my head. I can't get out of my own head. I'm so irritated with my wife and daughter all the time, and I just don't know why. Another fellow I saw this week with PTSD as well said, I feel like a caged animal. The restrictions have taken away all my coping mechanisms to deal with my mental health. I've lost social contact. I've lost most of the recreational things I used to do. I've lost the gym. I've lost sports. I've lost church. So many things that used to give me a breath are gone. A university student I see who's struggling with depression, she told me this week, at the end of the last term, it was so hard to study. I love studying with friends. Being with other people energizes me. But this last term, I felt so sad and lonely, and it just caught up with me. It was so hard to focus and finish what I needed to finish. During a couple session this week, both partners, they've been at home for the last year, working at home, and they were laughing together, both saying, well, I want more flexibility to stay at home when we get to the other side of this. But I really want you to go back to work as soon as possible. So this sort of cramping each other's style thing and yearning for more clearly defined boundaries between work and family. That's a common theme. A police member told me this week, out in the community, the ripple effects of isolation are going so far and wide. There's so many mental health calls. A suicidal 911 call came in last week from an elderly guy whose wife died 2 months ago. No family members could come and visit him. He was so isolated and grieving and desperate. Thinking, and again, in terms of my experience with clients over the last 8 or 10 months in workplaces, another big thing I've noticed is that conflicts and tensions have definitely been up. I'd mentioned working a lot, assessing injured workers a lot. So I've seen grocery store workers on stress leave due to repeated run-ins with angry customers over safety regulations. I've seen restaurant workers and nursing home workers with vulnerable family members at home who were ended up on medical leave because they just couldn't emotionally tolerate what felt like unsafe working conditions. I've seen healthcare workers in hospital guilt-ridden and heartbroken over the dilemma of enforcing COVID protocols and weighing that against the pain that visitors and families are feeling, wanting to visit their loved ones, and sometimes even saying final goodbyes or getting that final group family picture that's so hard to arrange for because of these COVID-19 restrictions, and just the toll that takes on compassionate people who have to weather those sorts of horrible moments. More generally, I've seen long-standing relationships between colleagues, people who've liked each other, gotten along well together for years, breaking down in the face of starkly opposing views on the pandemic. I've seen neighbors and friends pulling away from each other because they manage their social bubbles differently and wonder, is it safe to maintain contact with each other anymore? So to pull this together, a key takeaway for me, a year plus into this pandemic, is that the narrowing of our day-to-day lives in general, and in many cases, the loneliness and isolation that many of us are experiencing, and also these conflicts and disagreements at work that are common, and at home too, it's all converging and taking a toll. And the usual coping mechanisms and outlets that we've historically relied upon to de-stress, to recharge your batteries are less accessible. And all of this is a feeding ground for emotional distress. So I feel like it's all a pretty bleak picture I'm painting here. But in terms of solutions, a key one I believe is to try to help people to the extent possible to enhance and build upon their usual coping repertoires, to find new ways if they can to build more sense of control, even in a small way at a time where control feels so lacking for so many people. And as business owners and managers, I think something that many of us have learned is the importance of carefully listening to and responding to employees' concerns and worries. Positive and good communication and clear and supportive guidelines from the top, I believe, really fosters a sense of predictability and security. And hopefully safeguards against rising emotional tensions and distress. Another related and key point from a solution standpoint, I believe, and this is me as an emotionally focused therapist speaking, is strong social support and particularly a secure primary relationship. I believe is a really key protective factor against both the development of emotional distress and depression and anxiety and other things that come from that. And also the persistence of distress when it starts to take hold. We're internally wired for connection. The need for attachment's a fundamental part of all of us. And what I tell couples at the start of therapy is often is, you know, when we're together, when the us factor is strong, when there's a sense of connectivity between us, we can deal with almost anything. But conversely, when we feel alone, when we feel by ourselves, when we feel cut off, it's hard to tolerate almost anything. We can cope with almost nothing. So, you know, simply put, it's just really hard to maintain our emotional balance when we feel lonely, when we're secluded and we're disengaged and we're just flapping around in the water alone. So counteracting that is a big piece of where I put my focus day to day with clients. And I think that's a healing focus more broadly in the community to revitalize us mentally and emotionally as we push further through this difficult time. So, thank you.
No, I didn't. I didn't call you up looking for good news. No. Interesting perspective when you spoke about the couple, and one was saying, really like to keep working from home when this is all over, and I can't wait for you to go back to the office. To the other one, it kind of reminds me of the T-shirt that says something like, "Once this pandemic is over, I still don't want to see you anymore." No.
Yeah.
Thanks for that. Somebody had asked in the chat box or the Q&A forum, is there thoughts on practical solutions? And this individual had just done a wellness in the workplace event, and said there was some interesting trends and discussions that came out of that between speakers and attendees: respect, diversity, community engagement, and gratitude were all important emotions and feelings and to exercise towards folks that you work with, and I guess, you know, the folks that you live with, and, you know, the small number of folks that you manage to engage in any kind of leisure activities, going for walks or any other outdoor activities. So I thought those were interesting aspects that that Scott brought forward.
Mm-hmm.
Do you have a comment on that in there?
Well, it makes a lot of sense. Yeah, I think it's sort of on a case-by-case basis. It feels important to try to sort of build on the existing repertoire, but find creative ways to enhance it and sort of remember what worked in the past to foster better adjustment and functioning and life satisfaction, but getting creative about how to build on it, you know, whether it's hiking or taking up a new art expression, you know, painting, or finding ways outside to just enjoy loved ones. And but I guess just to reinforce my last point, I just think not losing sight of those key relationships that really make us tick, that can happen and can really lead to emotional distress rising, and it's important to keep that balance.
Yeah, thank you very much. Dr. Allison, you recently arrived in Nanaimo to take over as medical health officer. Tell us a little bit about what that entails, what you found when you arrived here in terms of community concerns regarding mental health and the multiple crises facing our community these days.
Thank you, Kim, and thank you, my colleagues. Dr. Fairweather, your sharing of the experience in the community clinic is really quite remarkable. As a medical health officer, there's about, a really important focus on the pandemic right now as an emergency response, but we're responsible for a very broad area in public health. I seek to prevent disease and injury, and we've mentioned a few of those situations. And self-harm and intentional injury are absolutely concerns, in our community when we think about worsening mental health and hopelessness. In public health, I seek to promote wellness and protect health in our health protection field. And additionally, the idea about understanding health needs. Prior to the pandemic, we were already concerned about certain sectors of the population. And I'd just like to focus on youth for a little bit. Prior to the pandemic, we were concerned about increasing rates of overweight and obesity. About 8% of youth were struggling with mental health, and 12% reported problematic substance use. 1 in 8 youth reported, well, actually, this is young adults, post-secondary students having unprotected sex while intoxicated. And then the idea about suicide and self-injury and intentional self-harm, it's the second highest cause of death behind accidental death and ahead of cancer for that young adult population. So these areas absolutely needed our attention before the pandemic. Since the pandemic, we've had a number of opportunities for feedback from the community through our BC COVID Speaks platform. We've done the survey in 2020, and then the recent iteration has just concluded the beginning of May, and we look forward to those results. But what they were able to show us is concerning for youth, and what I understand about where we were and where we're at now. We've got a lot of work to do. Economic well-being, 1 in 2 youth report, or young adults 18 to 30 report worsening financial situation, and more of them are unemployed, 13% compared to 8% of them being unemployed in 2020. There's been impacts to their education, either delays or cancellation of work settings and work experience and educational experiences, particularly if they have to travel abroad. Mental health outcomes are significantly worse than they've been before. And when we look in comparison of the young adults, 18 to 30, compared with those over 65, the young adults are 2 to 3 times more likely to say that their mental health has worsened, that they feel that COVID has been a threat to their mental health, and that their stress level has worsened over this time. Many of them report challenges in accessing health services. We know that that's a baseline in a health system that's overburdened. And then in the setting of decreased access because of isolation and certain protocols, many people report difficulty accessing services, and particularly those who are gender diverse. And those also experience disproportionate impacts to their mental health. With respect to health promoting behaviors, we are not doing so well. Many report that they are no longer exercising as a means to get to and from work because many are working from home. They report decreased fruit and vegetable, which is a consumption, which is a really good marker of a healthy lifestyle. So people are eating more junk food, they're not exercising, sleep is disturbed, and we see more use of alcohol and cannabis. So when we speak of these stressors, they can be offset by some protective factors like social connectivity, but yet folks definitely report that their social connectedness has been diminished. We do notice that some youth have to continue working, and youth are continuing to use public transit. They don't have as many quiet and safe places to work and study now that everybody's at home, so they are being more reliant on public spaces. And despite all of this and the great impacts to young adults' voices are not really part of the main narrative. The worries that we have are around severe illness and extremes of age, and certainly the youth are experiencing very significant impacts to their social, their health, the future potential, financial, and relational issues in homes. So again, more bad news. Yeah, what I'd like to say is that there is hope. And so a few things that are around the corner. I don't want to speak about coronavirus too much, but our case numbers are quite a bit lower than they've been for a while on the island. And across the province, we've seen the case rate decreasing. We've seen hospitalizations decrease. And we've seen ICU visits decrease. That all holds really well. I just checked the dashboard. 52.4% of adults on Vancouver Island over 18 have been vaccinated as of the end of day yesterday. So we're really moving quickly towards our target of 80% of adults greater than age 18 being vaccinated. As we see our vaccination rates increasing, as we see our case rates lowering, the conversations are evolving to recovery and resiliency conversations more often rather than response. And that really holds hope for me in the future. And it's through forums like this and conversations with community that we need to understand what are the actions we need to take in our community to offset some of these remarkable and measurable effects that have taken place during the pandemic. What I do know about people and individuals as a family physician and working in a setting much like Dr. Fairweather in the stresses and the pressures that individuals are facing, what we have heard is that people are floundering and languishing. And I think people have heard the term languishing, but there's an opportunity ahead of us for flourishing. And flourishing is absolutely an outcome of a mindset and of relationships and positive influences around people. And if people can incorporate more positive mindset and positive influences around them, ensure that they're engaging and not withdrawing, that they have positive relationships, and then find meaning and even small accomplishments in life, those factors can be really influential over somebody feeling like they're languishing or they're flourishing. So for an individual to find something where they can find meaning and they can make small accomplishments, and that can be through things in their control, whether it's undertaking smaller things in their home, like new hobbies, or enhancing certain aspects of maybe something that they had been interested in before, and they're seeking meaning through either relationships or certain special interests. I think that these are ways that people have been able to kind of keep themselves going. Meanwhile, I think everybody is seeing that stamina is flagging. People just don't have enough kind of gas in the tank to get them across the finish line. So I'm hopeful that as May long weekend falls behind us and we see some changes to some of the public health measures coming into the summer, we're going to see some opening and some places where hope can start to grow, and hopefully with some collaboration through community and other levels of government, we can restore some pieces of our community safely, yet making room for individuals who may feel that it's not time yet, it's not quite safe yet. And so we want to make sure that we don't worsen equity and have people remaining isolated at home when they can be returning to activity as safely as they can. Prior to the pandemic, we recognized that sedentary behavior and social isolation were both factors extremely important to health, and at sometimes equated to having a negative effect as bad as smoking. And so while people were sedentary and remaining isolated to protect themselves from the risk of the pandemic and coronavirus transmission, now that we see our transmission is lower and people are protected with vaccine, we really want to make sure that we are returning to activities that are healthful and health promoting, and not sticking with things that were keeping us social isolated. So these are things we're going to help each other and reach out to neighbors and restore those connections as we go forward. So I'm really excited to hear the questions and any opportunities or suggestions that people have for how public health can support the community to recover.
Thank you very much. It is interesting to note, as you indicated, just over 52% of public over the age of 18 are now vaccinated, and with the accelerated vaccination program now in place. We just are receiving news today and yesterday that as of Sunday, everybody 18 plus can start to arrange and make bookings for their vaccination. And I think that something as positive as that helps to lift the kind of a bit of the weight off of all of us all at once. And I'll be interested to watch Dr. Henry and Minister Dix in the future continue to talk about some of the progress that we're making to continue to shine a positive light on our lives going forward. In Britain, when Prime Minister Johnson stood up in Parliament and started to announce specific dates when things could return to what we used to call normal, and you could almost see the other members in the House, their shoulders starting to relax, as the Prime Minister said, and on March 21st, the pubs will open, and on April 1, golf courses will open or whatever, and everybody just going like, oh, letting out that sigh of relief and wishing for the good news to continue. It's so important to us to have those little bits of good news now that we've had 16 months of bad news. Minister Malcolmson, you've taken over a portfolio right around 2 years old in that ministry. It's a ministry that receives a tremendous amount of attention because of our social need and, again, the multiple crises we're faced with in a province. Can you tell us about government's initiative and your objectives that would lead to, in your opinion, your ministry's success?
Thanks, Kim, for the question and the conversation. Reflecting on your comments right now, I'm reminded of my nephew saying to me yesterday, he's in grade 1 and he lives, he's missing his friends and school is dislocated for him. And he said, today I learned how to be alone. Which is a big thing for a little guy with a big brother who's the center of his world. It turns out what had happened is he'd got lost when the rest of the kids were playing hide and go seek outside, and that was the way that he managed to have a few minutes alone. But what a profound teaching, how to be alone. But that is not answering your question. So yeah, this was a big step that Premier Horgan made in 2017 when he and his caucus formed government. This is the first Ministry of Mental Health and Addictions in Canada, and my friend and predecessor, Judy Darcy, was the first Minister of Mental Health and Addictions in Canada. It's since been picked up by a couple other provinces in some form, and I'm the second minister. The service delivery for programs still goes through the education system or the Ministry of Children and Families, or most particularly health. It's mostly the health authorities that deliver mental health and addiction services. But the intention when our ministry was set up is that there would be one minister who is singularly focused on knitting together the responses from different ministries, and recognizing that this was an unattended crisis in BC and a part of the healthcare system that couldn't have the focus. Now, even more amplified during the time of pandemic, where we have Minister Dix, necessarily focused 100% on COVID response. So to have me being responsible for the overdose emergency response, and also having now inherited what's called the Pathway to Hope. This is British Columbia's design and roadmap for building up that system of mental health and addictions care that didn't exist when we formed government. The Pathway to Hope was built by the input of British Columbians, people working on the front lines, who told us how difficult it was to navigate the system, how many families trying to advocate for supports for their children and youth had seen their kids fall through the cracks or found the system very difficult to navigate, and identifying a lot of gaps in it. So that's the Pathway to Hope is now the roadmap for us, and adding every year, what seems like sometimes every week, new pieces of that pathway to build up that continuum of care so that people don't fall through the cracks. And then now fighting 2 public health emergencies at the same time. And certainly we're all have our eyes wide open about the mental health impacts of the pandemic, the shadow pandemic, as Dr. Fairweather has really clearly articulated. So I'll just talk for just a minute, Kim, just about some of the pieces. And there's so much, and I don't want to get into the kind of practice of, reciting lists of activities, but I think one that intersects particularly with the Chamber's work is the role of leaders and employers in both supporting conversations about mental health in the workplace, since that is the place that people spend often the majority of their time. Employers being in a position to have brave conversations about themselves not doing so well, whether it's with mental health or addictions challenges, and then also helping employees navigate the supports available to them to attend to problems before they reach a crisis point. A year ago, my ministry, in cooperation with many others, built out mental health workplace support called Caring for Caregivers that was particularly focused on people working in the long-term care sector, which was so under intense pressure a year ago. So that was a good model. And just about a month ago or so, that was expanded to other workplaces that had been self-identified as being under particular pressure, particularly people working in tourism, hospitality, and social services. And so I'd be interested if members and participants today go to workmentalhealthbc.ca. It's a portal that's being built on, especially out through this spring. So more will come in the form of training modules and examples of the kind of ways to lead conversation within workplaces, but also just some simple steps that people can take individually. We're really hearing and learning, particularly over this year where we had to transform service delivery and counseling and mental health support, a lot of it onto a virtual platform. We're learning that people do engage with supports in very different ways. And so that's one example of a way that people in the workplace can navigate to supports. And this website probably is applicable for everybody. It was just built in particular with some of those sectors that are under particular pressure. Another example of expansion of supports that is well underway in BC, but we're going to see more waves, is the expansion of mental health and addiction services through urgent primary care centers. Recognizing that we just don't have enough primary care providers, family doctors in the traditional realm. And especially in a center like Nanaimo, we just aren't going to have as many as we need. And so for people to be able to find attachment through the urgent primary care center, Nanaimo's one that we opened a couple of years ago is in Port Place Mall, Medical Arts. There's also another one, kind of a version of it, in the nurse practitioner clinic in South Nanaimo, Nexus. It's the first in British Columbia. And so Nanaimo's was the first, both places where people can get attached to a team of primary care providers, and mental health and addiction supports are a key part of that. And definitely raise my hands to the nurse practitioners at Nexus who are prescribing medication-assisted treatment for people on opioid use disorder, a really important part of service delivery that we are 100% reliant on prescribers to support people with. So 23 urgent primary care centers exist around the province, and more to come. Another sort of a team-based approach and an innovation which speaks in particular to the issues that Dr. Allison raised for youth is the really successful Foundry model. Started in Victoria, has now spread to, I think, 12 across the province, and more to come. Nanaimo had a fantastic application, which didn't proceed. Just there was such strong competition from other communities, but I'm very supportive of working with Nanaimo leaders to have Nanaimo have its own Foundry youth center that is focused on primary care provision, a lot of peer support around mental health and addictions counseling. During the pandemic, again, another innovation, Foundry moved to an online platform as they had to practice social distancing and reduce capacity at their physical centers, but that had the effect of making the online platform available to so many people. Turns out in some communities, there's a completely different slice of the youth community that were willing to engage in an online format that hadn't wanted to walk through the front doors of the center. And then just a week ago, we launched a many years in the making app that Foundry Youth had designed and built with support, where young people ages 12 to 24, I believe the range is, can book online counseling appointments, join group therapy sessions. And one of the pieces of this is not having to tell their stories again and again repeatedly. And I am told by many people accessing mental health and addiction supports that that is particularly traumatizing, to tell the same story again and again. So one of the things that this Foundry app does for young people is provide an appropriate way to tell the story once, lock it in, and then that's available to the next practitioner or person within the suite of youth health supports that are available. So anyway, just a week since it's been officially launched, but anybody can go to the App Store, download the Foundry app, especially if you've got young people in your life. I really encourage you to kick the tires on that. There's so much more that we can talk about, Kim, but maybe I'll just pass that back to you and we'll keep the conversation going, particularly about people's particular questions or concerns about accessing services at this really difficult time.
Thanks very much. We've got a slide at the end of the session here today, which is going to indicate some of those supports and how to reach them. And we've had that posted on our website for pretty much the entire pandemic now. So we've been publicizing access and here's where you go to get supports, and don't be afraid to reach out, et cetera, et cetera. As we're kind of closing down here, 3/4 of the way through, Dr. Fairweather, what kind of self-help tips and ideas for nurturing our own mental health can you give us, Dr. Fairweather, if just to make sure that, you know, we're not falling off the edge ourselves and not even really realizing it, you know, to the point where our partners or those close to us have to say, hey, you know, you're pretty testy lately, or, you know, you seem to, you know, to have a really short fuse, and, you know, argue over who gets to hold the remote control that we never had before and things like that. So how can we stop ourselves from getting there? How can we recognize within ourselves that, you know, maybe we're losing it, you know?
Yeah, good question. Well, I'm thinking of some of the things that Dr. Allison touched on in her portion. I feel like it's just going back to basics. I feel like there are some just key things that are important not to lose sight of. You know, Dr. Allison mentioned, of course, exercise, curbing alcohol use, and other sort of more dysfunctional ways of regulating distress and emotion that would be, I think, easier to fall into in this isolated time we're in. So staying active, and again, I'm a broken record, but you know, I just feel like I say this to people I work with and supervise and train. You know, don't suffer alone. If you're distressed, if things are bothering you, it's just really important to have some trusted places that you can go and sort of, you know, fall apart a bit, you know, or a lot, and just feel like you don't need to prop up some illusion that you have all the answers or sort of have it all together, because I feel like that's actually how we keep it together, is to have safe places where we don't have to keep it together. So I just feel like that's a real fundamental thing I've learned, and want to pass on to others. Um, and at the risk of being repetitive too, I think, just trying to find ways to immerse ourselves into something else other than, say, work that we might also get swallowed up into. I think there are lots of ways to just lose balance and focus in an age like this. I've met people that are just working double time. So being able to find other avenues and places to put energy and just lose yourself in something else, whether it's playing music or being creative in some other way, like I was saying before, in terms of painting. Somebody I met who's really getting into pottery, never knew how to do pottery, but is getting into pottery. And so I think there's sort of an endless sort of list of possible activities that you could look at. But to me, the point I would want to keep underscoring is just to stay connected with others, but especially your key group. One thing that I might mention that's a really good resource for couples that I recommend. There's an online program called Hold Me Tight Online that was developed by Dr. Sue Johnson, who was one of my main mentors and trainers, and now a colleague. Worked with her down in Victoria, along with Dr. Campbell, and she's written a great book for couples called Hold Me Tight, and there's an offshoot of that, this resource, holdmetightonline.com, where there's a structured program that's designed to help enhance relationships and help couples get through raw spots and fight through negative patterns, that we all get stuck in. Every relationship I think that exists, certainly mine does, and everyone I've ever met, that we get stuck in these patterns that this sort of here we go again thing. And if couples can fight through that and understand that and sort of pull apart the mechanics of that and share more authentically and deeply, it can just open up connectivity that's really the oxygen we're all after, I think.
Yeah, very true, and interesting that you say that one of the effects that you see of this is people working a tremendous amount of time, and this is actually a way of hiding from what's going on. I've never met so many people who have said since the pandemic, I don't go to work, but I've never worked so hard in my life. So that's very interesting. Dr. Allison, for those who are employers out there, most are concerned for their staff who feel pressure to maintain levels of productivity and performance in spite of the challenges of the pandemic. So do you have a few words in closing for employers and supervisors to maintain positive mental health in the workplace?
Oh, this is a great topic, and I'm so glad you raised it. Based on neurobiology theory, which is really important because what you're trying to do is try to meet their needs, that reptilian brain, and try to speak to them and make sure that they're feeling safe in the workplace so that they can be as productive as you want them to be. And just as an employer, you are setting those expectations. And that speaks to some of that neurobiology theories, because things that are out of control of an employee will definitely worsen their stress. An employee needs to understand kind of where they're at and what their status is. And having uncertainty will definitely also worsen things in the workplace. Ensuring that things appear fair in the workplace and that people feel a sense of connectedness and a relatedness to their team, amongst their team, to their workplace, really important for outcomes at the workplace. So addressing individual status, the certainty in the workplace, trying to ensure they have some autonomy, getting a sense of relatedness, that they feel that there's a team that they belong to, and ensuring that there is a definite sense of fairness will make things better in the workplace. But given all the conditions that are in place in our situations, it may be hard to address that, but certainly just having an approach to one or two of those things, giving people choices, just like we do in other situations. People feel much better when they have a choice than when they're just told no. Giving them some control over things, I think, will make a difference in the mental wellness for workers in the workplace. Yeah.
Broke the mute law. All very, very important points. And I think things that employers and supervisors, team leaders need to keep in mind. You don't know what folks are going through when they're not in the workplace. So trying to keep the workplace as positive and supportive as possible is absolutely essential. Minister Malcolmson, can you give us a little idea of what to expect further out of Budget 2021 and how that's going to support people across the province with mental health and addiction support and treatment, especially with a focus on Nanaimo, of course?
Yeah, thank you, Kim. The advocacy, well, the need in Nanaimo is so deep in the advocacy of organizations here. As you know, I really see a lot of it reflected in the budget and in the election platform that the Premier pulled together to see continued investment in affordable housing, which is such a foundation for mental health. You know, we've got, all told, it's getting close to 1,000 affordable housing units that we will be opening, and some of them already open. The assignment that I've been given to design and build what we're calling complex care housing, the people for whom supportive housing is not enough. So we're doing the work right now to attend to identifying who is it. Is it people with active psychosis? Is it people living with acquired brain injury? You know, what's been at the underlying behavior that makes them poor tenants or poor roommates? The work that we already have committed to in Nanaimo, the homelessness navigation center, which hasn't yet opened, but designed to be that bridge to housing, to give people the skills that they can retain housing once they obtain it. And try to get that chronic homelessness met where it is. But that's all pre-existing work. The budget that was tabled, I guess just about 3 weeks ago now, $500 million for mental health and addictions over the next 3 years. It's a historic level of investment, and the need is there. There's no question. So suicide prevention, mental health supports, new support for eating disorders, something that we hear about here in town. First Nations Health Authority, new supports on top of the healing centers that we're already funding $20 million worth of construction with all across British Columbia. Almost $350 million on fighting the overdose crisis and other areas of addictions treatment, another 200 treatment and recovery beds that will be built with the funding that was announced, further expansion of safe supply from a prescriber as a way to separate people from the toxic drug supply that's killing people. But going to before the budget, I want people in Nanaimo to know we've funded 20 new adult treatment and recovery beds, 10 publicly funded beds at Clearview and not Clearview, Edgewood, and 15 that John Howard Society is going to stand up. They, I hope, will be up and running soon. But that's just one piece of the addictions and mental health treatment that's going to be that's needed province-wide, but will be coming to Nanaimo. And it's a testament to the community organizations that have been calling clearly for the need, but also offering to actually provide the service as well. All vital pieces and all supported by the budget that we've just tabled. So lots of new programs and new announcements that are going to continue to roll out, but wanting people to know both that the need is deeply recognized, and we sure feel it on the streets here, but from a cross-government perspective, the degree of cooperation between ministries, that we have a new cabinet committee on mental health, homelessness, and addictions that David Eby chairs, and I'm the vice chair. This is one of the many examples of where we're working across government to try to bring that systems change that means that we're in a stronger footing. The next time something really tough like COVID hits, we will be in a better position to withstand shocks like this, because the imperative is clear, and we know the public supports investment in this area, and we are do not want to test the patience of people in communities that are both living a very hard life and also the community impacts that are felt by not having people with mental health and addictions challenges able to access services when and where they need them, and to be treated with dignity. I look forward to more conversations about this, and grateful again to the Chamber for providing the place to have this first conversation.
Thanks so much, Minister Malcolmson. The Chamber has been sitting on the Mayor and Council's Health and Housing Task Force for the last 19 months and working going forward now on implementing the action plans that came out of that 19 months of work by so many in the community. So I am intimately aware of the situation that we're faced with and the many different perspectives and facets of that. According to the latest round of research from Canadian Mental Health Association, UBC researchers, an alarming 77% of adults report feeling worried or anxious, bored, stressed, lonely or isolated, and sad. These difficult feelings may, in fact, be a fitting emotional response to the difficult times we're in. As the CMHA says, hashtag get real about how you feel. And they also say, name it, don't numb it. In other words, don't hide from difficulties that you're facing. Reach out. I like staff to put up the slide now on the supports. So here's some ways that we think that you could find help quite easily. This is on a chamber page, so nanaimochamber.bc.ca/health supports, and you'll find these contacts in there. You can also call this number, 310-6789. No area code necessary. It's just 310-6789 for information on referrals on mental health. Never be afraid to ask for help. Your mental well-being is essential to good health. Our mental well-being across the community is essential to a healthy community. So thanks, Minister Malcolmson, Dr. Allison, and Dr. Fairweather for helping us here today and for being around to help our community all the time. And thanks to our audience for joining us today. I hope this has been a help to all of you. Reach out by email if you have any questions for the speakers today, and we'll be happy to connect you to them. Thanks very much. Have a great day.
Thank you.